Welcome to Pathology. Today we will talk about pathology of the tissue growth. Lecture number 7. The plan of lecture include hyperbiotic and hypobiotic processes. So we will discuss neoplasia, tumors, nomenclature of tumors, carcinogenic factors, pathogenic mechanisms of tumors, and proto-oncogenes, tumor suppressor genes, genes of the apoptosis, and genes of the DNA repair system, and the main features, characteristic features of the tumors, atypicalness, metastasis, and at last the mechanisms of the antiblastomic resistance of organism. The growth of the healthy organism or its individual cells, tissues, and organs ensures an optimal adaptation of the external environment. This adaptation is characterized by change in the number, size, phenotype, and function. For example, during pregnancy, growth in the uterus and breast is caused by hormones in accordance with physiological requirements. If tissue and organ growth don't meet needs of the body, pathology of the tissue growth occurs. Pathology of tissue growth may occur at all stages of individual maturation of the body, in prenatal period and postnatal period. The prenatal period or intrauterine period lasts 270 days after fertilization. This period is divided into the stage of progenesis and chematogenesis. The stage of progenesis involves the maturation and production of the sexual cells, gametoparties. Gametoparties occur in this period of the development. The stage of the chematogenesis covers the period from fertilization till birth. Defects that occur during the course of the chematogenesis are called chematoparties. The cause of it may be genetic maturation or genetic mutation and acquired physical factors, for example, ionizing radiation, chemical factors as some drugs, hormones, and biological factors, for example, viruses, microorganisms, and etc. The illness and bad habits of a mother during pregnancy contributes to the development of the abnormalities and the premature end of the pregnancy. This phase, the chematogenesis consists of 3 stages. The first stage is period of the blastogenesis. This it's the first 15 days of pregnancy after fertilization. The pathologies that develop during this period include, for example, Siam twins or cyclopean and so on. The period of the embryogenesis continue from the 16 days till the 75 days of the pregnancy. If the pregnant women become addicted to bad habits, for example, misuse of the alcohol and the embryopathies such as agenesia, it means absence of the organ, or atresia, absence of the natural channel holes in the organs, and duplication of organ, or ectopy, which means the dislocation of organ, may develop in this period, in the embryogenesis. And the third period is phytogenesis. This lasts from the 76 days till the end of the pregnancy, till 280 days. And the pathology of this period include cryptarchism, or, for example, anomaly of the bile duct, and so on. In the postnatal period of the development, cells, tissues, and organs of the body undergo various physiological and pathological changes. They are divided into 2 groups: hyperbiotic processes and hypobiotic processes. Hyperbiotic and hypobiotic processes. Hypobiotic process means the weakening in tissue growth. This includes atrophy, dystrophy, degeneration of tissue, and hyperbiotic processes are accompanied increased growth of the cells and tissue. These include hypertrophy, hyperplasia, regeneration, metaplasia, dysplasia, and at last neoplasia. Atrophy is a pathological process accompanied by decrease in the volume and the mass of cells, tissues, and organs. The function of tissue and organ is weakened in this case. The main cause of the atrophy include lack of food, lack of activity, impaired blood supply, tissue innervation, old age, decreased endocrine gland function. Physiological and pathological types of atrophy are distinguished. Examples for physiological atrophy include obliteration of umbilical artery and bottle duct newborns, decreasing of the volume of intervertebral cartilage in old age, for example. Pathological atrophy can be general and local. During starvation, alimentary dystrophy, cachexia, general atrophy of all body is observed. And if you, for example, in pituitary dysfunction, Simon's diseases, the cerebral cachexia, the tuberculosis lead to the general pathological atrophy. There are several types of local pathological atrophy. The first type is dysfunctional atrophy. It occurs as a result of inactivity in diseases associated with decreased mobility and bone fractures. After tooth extraction, dental alveoli, after removal of the eye or the optic nerve, they undergo to the atrophy. In experiments, this type of atrophy can be created by cutting the skeletal muscle tendon. The next type is the neurogenic atrophy. This type of atrophy develops as a result of disturbance in the innervation of organs or tissues. The denervation of tissue leads to the impaired normal blood supply to the tissue, functional inactivity of tissue. The next type, atrophy from a prolonged compression an organ or tissue. In the mechanism of this type of atrophy, impaired blood supply to the cell and hypoxia play a leading role. And an example of this type of atrophy is atrophy of the nerve cell during hydrops of the brain, as well as atrophy develops in the renal tissue during hydronephrosis due to the obstruction of the urinary tract. And the third form is atrophy arising from the influence of physical, chemical, some pharmacological factors. An example of this type of atrophy is a beta cell atrophy of the beta cells of pancreatic islets, resulting from the action of alloxan. Alloxan is a substance which selectively damages the beta cells, and beta cells goes into the atrophy. Some hormonal drugs, for example, hydrocarbons, may lead to the atrophy of the endocrine glands, adrenal cortex. And hyperbiotic processes. In this slide, you see some of them: hypertrophy, hyperplasia, metaplasia. And at first, we will discuss the types of the hypertrophy. Hypertrophy is an increase in the volume and the mass of tissue or organ due to increase in the volume of the cell. Sometimes the volume of tissue increases due to an increase in the number of cells. An increase in tissue and organ mass due to an increase in the number of cells is called hyperplasia. Cells that are able to divide undergo hyperplasia, and cells that are not able to divide undergo hypertrophy. Hypertrophy may be physiological and pathological too. The cause of hypertrophy is associated with an increase in the functional needs of organs and tissues or hormonal influence. There are several types of hypertrophy. The first, for example, work hypertrophy. Usually this is a reversible process which is based on the straightening of the anabolic processes that structurally provide increased cell function and cell organelle hyperplasia. The example is hypertrophy of the heart and skeletal muscles in athletes, an increase in the breast during lactation, and an increase in the smooth muscle fibers in the uterus during pregnancy. All they are the examples for this type of work hypertrophy. This type of hypertrophy is classified as physiological hypertrophy. In the previous slide, we talk about the physiological type of hypertrophy, the work hypertrophy, and here about some pathological forms of the hypertrophy. Sometimes the functional deficiency of some organ, for example heart, are compensated by hypertrophy. However, At a certain stage, while maintaining the pathological conditions, decompensation occurred, and with the development of dystrophic change in cells, decreased functions, and often change in the shape and tonicity of the organ. And since under the conditions cardiac muscle hypertrophy occurs regardless of the growth of the skeletal muscle, the pathological type of hypertrophy occurs. Then the next type is called the replacing compensatory or vicar hypertrophy. Disturbance of the activity of one of the paired organs, for example, one kidney, the adrenal gland, due to the illness or surgical removal from the body leads to the increased activity of the other the organ. Despite the increased activity of hypertrophied organ, it cannot carry out the work of the both organs. And the next is regenerative hypertrophy, is understood to mean an increase in remaining healthy part of damaged or removed organ, the liver, pancreas, spleen, and etc. And correlation the hypertrophy. This occurs when the activity of one of the functionally related organs ceases. In this case, another organ undergoes to hypertrophy. For example, after removal of the thyroid gland, the anterior part of pituitary gland increases. Besides of these, true and false hypertrophy are distinguished depending on the hypertrophy of the parenchymal cells or tissue stroma. In true hypertrophy, the volume of the parenchymal elements of organ tissue increases. Sometimes the volume of organ increases due to the excessive development of the connective tissue and fat cells. This is called false hypertrophy. Hyperplasia means increasing of the volume of tissue as a result of an increase the number of cells. The cell division accelerates in this case. In some case, damage of some organs as liver, kidney, the recovery occurs both due to hypertrophy and hyperplasia. Hyperplasia also can be physiological and pathological. The glandular epithelium of the breast in the women during puberty and pregnancy is an example of physiological type of the hormonal hyperplasia. And compensatory hyperplasia, after partial resection of the liver, the number of remaining cells increase due to mitosis. As a result, the liver restores its normal mass. The main cause of the pathological hyperplasia is an increase in the stimulating effect of hormones and growth factors. For example, after normal menstrual cycle, proliferation of the endometrial epithelial cells is observed. This process is stimulated by the pituitary hormones and estrogens synthesized in the ovaries, and they inhibited by progesterone. If the balance between estrogens and progesterone due to increased estrogen content is disturbed, pathological endometrial hyperplasia occur, and this leads to the abnormal menstrual bleeding. Hyperplasia caused by the action of growth factors, which are secreted by infected cells and the papillomaviruses, is manifested by the formation of the warts on the skin. Decrease in hormones and growth factors eliminates the hyperplasia, and unlike tumors, pathological hyperplasia is subject to the regulatory mechanisms of the body. Regeneration is a restoration of tissue destroyed or lost parts of organs. Physiological, reparative, pathological forms of regeneration are distinguished. Physiological regeneration is a process of the constant renewal of the cells of the body throughout the life. For example, blood cells, epidermis, after passing a certain life cycle, undergo apoptosis and are replaced by new cells. Dividing cells undergo physiological regeneration. The number of the organs, bone marrow, gastrointestinal mucosa, respiratory tract, and others, due to the division of their cells by mitosis, have the ability to intensive regeneration. Some cells, for example, ganglions of the brain, regenerate to the intracellular organelles and membrane renewal. Intracellular regeneration is stimulated by specific and non-specific factors. Specific factors include nerve growth factor, and non-specific factor may be, for example, hypoxia or the protective inhibition. The reparative regeneration is observed in damaged tissue and injured cells. This regeneration, as well as physiological regeneration, provides the replacement of the destroyed cells with new cells. The basis of the reparative and physiological regeneration is the same mechanisms, but the difference lies in the fact that physiological regeneration is the replacement by new cells of the cells destroyed naturally. But reparative regeneration is a replacement by new cells of the cells destroyed by a particular pathology. Reparative regeneration has slightly greater intensity. Therefore, reparative regeneration is considered as a response of the body to damage. Depending on the fact that the same tissue or connective tissue forms at the site of destroyed tissue, complete, which is called restitution, and incomplete, which is called substitution. The complete and incomplete types of reparative regeneration develop. Complete regeneration is characteristic of tissue with a high proliferating ability of cells. For example, the skin, mucous membranes, and incomplete regeneration is characteristic of the tissue with a low ability to proliferate. For example, cardiac, muscle, brain tissue. In incomplete regeneration, connective tissue scar develops in the place of damaged tissue. The pathological regeneration, the restoration of destroyed tissue, occurs in a distorted form. This includes hyperregeneration, hyporegeneration, metaplasia, and dysplasia. In hyperregeneration, a large amount of new tissue is formed at the site of destroyed tissue, for example, keloid scar. And in hyporegeneration, a small amount of the tissue is formed at the site of injured tissue, for example, slow healing of the wounds. Metaplasia and dysplasia. In both of them, genetic reprogramming occurs in the genome of the cells. And metaplasia, during metaplasia, one type of cell is replaced by another type of cell originating from the same germinal layer. For example, displacement of the cylindric respiratory epithelium of the mucous membrane of the respiratory tract with squamous epithelium in smokers. And mesenchymal cells can also undergo metaplasia. For example, the ossification of the damaged area in soft tissue. Dysplasia is a disturbance of the differentiation in tissue, accompanied by an increase in the number of cells in the tissue with different size, shape, and structure. Dysplasia plays a role in the condition for the development of tumor neoplasia. For example, mucosal dysplasia of the stomach is found in the patients with a stomach ulcer can turn into the cancer. And now neoplasia. Neoplasia is unlimited, excessive, rapid, abnormal proliferation of cells that leads to the formation of the tumor mass. This process arises under the influence of the carcinogenic factors. Neoplasia is a typical pathological process that can be regulated by mechanisms of the body and characterized by unlimited cell proliferation, which leads to the development of tumor. The formation of the tumor tissue is characterized by disturbance in the genetic control of the cell circle due to the action of the various oncogenic factors. These oncogenic factors cause the mutation in the genome of the cells, despite of metaplasia and dysplasia. In the previous slide, we note that in metaplasia and dysplasia, it's a genetic reprogramming in the genome of cells, but here in neoplasia, it's the oncogenic mutation occur in the genome of the cells. Tumor overgrowth is a local manifestation of the common tumor disease in the body. Nomenclature of tumors. For the name of tumors, the name of the tissue where the tumor develops is supplemented with the suffix "oma". For example, tumors of bone, osteoma; tumors of the fat tissue, lipoma; vascular tumors, the angioma; tumors of the gland, adenoma. And the name of the number of tumor is taken from the name of the organ in which they formed. For example, hepatoma, thymoma, thymoma. And malignant tumors of the epithelial cells are called cancer or carcinoma. Malignant tumors of connective tissue called sarcoma. Names of mesenchymal tumors require the type of this tissue: osteosarcoma, myosarcoma, angiosarcoma, fibrosarcoma. And here in this slide you see the common tumors of the mesenchymal origin. For example, fibroma, myoma, leiomyoma. Leiomyoma tumor developed from the smooth muscle, and the malignant form of this tumor called leiomyosarcoma, or rhabdomyoma, tumor developed from striated muscle. And the malignant form type of this tumor we call rhabdomyosarcoma. You see here in this slide the malignant tumors, both of them malignant tumors, adenocarcinoma in the rectum and carcinoma in the large intestine. As we noted previously, the malignant tumors of the epithelial tissue are called carcinoma. And here in this slide you see the adenocarcinoma developed in the rectum. And the next is the carcinoma of the large intestine, both of the malignant tumors. This slide demonstrates the mesenchymal tumors. The first, you see the leiomyoma, tumor developed from the smooth muscle. The hemangioma, tumor of the vascular origin, and lymphangioma you see here in the face. The lymphangioma is the tumor developed from the lymph vessels. Fibroma, tumors of connective tissue. It frequently is observed in the breast, uterus, but in this slide you see fibroma developed in the finger of patient. Tumors are divided into benign and malignant. And the slide shows us the tumor in the uterus, in the wall of the uterus. The leiomyoma, benign leiomyoma, it's a tumor arising from the smooth muscle of the uterus. And the next is leiomyosarcoma, the malignant type of this tumor. And here below you see the main characteristic, the differences between benign and malignant tumors. And the benign tumors grow, you see here, by expansive way. Their edges are smooth, limited by capsule. They develop slowly and pushing the surrounding tissue. They don't penetrate into the tissue, don't metastase. The metabolism in them does not differ from the metabolism in the healthy tissue, and they rarely relapse. Malignant tumors consist of the cell in the low differentiation or undifferentiated cells, where the benign tumors consist of well differentiated cells. Malignant tumors have really all types of the atypicalness: biochemical, cellular, tissue atypicalness. They are characterized by invasion, rapid growth. They grow into the surrounding tissue, and due to lack of the capsule, they don't have clear boundaries. They give metastases and relapses. Their metabolism is perverted, it leads to the intoxication of organisms, it leads to the cachexia of the body. There are tumors that occupy an intermediate position between benign and malignant tumor, not shown here, and they called the carcinoma in situ. Carcinoma in situ has a number of atypicalness characteristics for malignant tumors. However, due to the presence of the capsule, it does not grow invasively and does not metastase. But after a certain time, activation can be observed in these tumors, in carcinoma in situ, due to the fact that As a result of additional mutations, these tumors acquire new properties, invasiveness, and the ability to metastasize. Etiology of tumors. The factors that cause the formation of tumors are called carcinogens. This means forming cancer or tumor. These factors acting on the genetic apparatus of the normal cell lead to the mutation in the genes involved in cell division. As a result of action of carcinogenic factors, a normal cell is transformed into the neoplastic cell, tumor cell. And exogenous, you see in here, and endogenous carcinogenic factor are distinguished. You see here all the exogenous factors. Exogenous carcinogenic factors include physical, chemical, mechanical, also and biological carcinogens. Among the physical carcinogens, various types of ionizing radiation, for example, X-rays, gamma rays, ultraviolet rays are of great importance. These factors directly affect DNA molecule, change its structure, gene mutation, chromosomal aberration, and regular intake very hot food, for example, as a thermal factor, plays a large role in the formation of the malignant tumor in the oral mucosa. As a result of prolonged mechanical irritation in the stomach, lungs, rectum, and other organs, malignant tumors can form. Among the etiological factors, the malignant tumor, chemical carcinogens play the leading role, and according to WHO, the 80% of all tumors are caused by chemical carcinogens. Chemical carcinogens are understood to mean compounds that can pass through the cell membrane and, entering the cell nucleus, enter the chemical reaction with nucleotides. Chemical carcinogens, by origin, are divided in organic and inorganic. Also, chemical carcinogens are of direct and indirect type of the action. Carcinogens that have a direct effect without undergoing any transformation in the body directly affect the genetic apparatus of the cell and lead to the development of the tumors. Such compounds include, for example, epoxides, alkylating compounds, acetylating compounds, the factors, and others. The carcinogens that have indirect effect can have an effect after the series of the metabolic transformations in the body. This group of the compounds include polycyclic aromatic hydrocarbons, aromatic amins, nitrosic compounds, aflatoksin, and others. At last, biological cancerogens include oncogenic viruses. Viruses that have genes that are identical to the body, proto-oncogenes, are called oncoviruses. Oncogenic viruses are DNA and RNA containing. DNA containing oncoviruses include human papillomavirus, which cause the benign tumors in the skin, female genital organs, in larynx, for example. Then Epstein-Barr viruses is called the causative agent of the Burkitt lymphoma. Then human herpes virus A, Kaposi sarcoma cause, and the hepatitis B virus, the main reason of the hepatocellular carcinoma. And the human T lymphoma virus 1 belongs to the RNA containing retrovirus. The DNA gene of oncoviruses penetrating the genome of the target cell ensures its transformation into the tumor cell. In the genome of RNA containing retroviruses is a gene encoding the enzyme revertase or reverse transcriptase. This enzyme based on the RNA matrix synthesis a copy of DNA. Such a copy of DNA integrating into the genome of a cell cause expression of the oncogene and transformation into the tumor cell. Viral oncogenesis is realized by two molecular mechanisms, epigenomic mechanism and mutation mechanism. In the epigenomic mechanism, the virus genome easily binds to the genome of the normal cell, and the normal cell transforms into the tumor cell. But in mutation mechanism, viruses, after their integration into the genome of the normal cell, subject it to a proto-oncogene mutation. turn into an oncogen and lead to the development of the tumor. There are several stages in the virus cancerogenesis. The first is cytoreception. It means the interaction of the virus with the receptors on the plasma membrane of the normal cell. The next is internalization, which means the penetration of the virus into the cell. Then integration means connection of the virus genome with the cell of genome. And this central and crucial stage of the viral oncogenesis. And virus, the next step, virus persistence in the cellular genome. In this case, the virus multiplies with the cell. And then cell transformation, promotion, and tumor progression, the main steps or stages in the viral carcinogenesis. The pathogenesis of the tumor neoplasia based on the mutation. The basis of the cell transformation is irreversible damage to the DNA molecule. In the occurrence of the tumors, the decisive role is played by physical, chemical, biological, carcinogenic factors, as well as the conditions and hereditary predispositions that ensure the implementation of their action. The hereditary predisposition to the occurrence of the tumor diseases is associated with the mutation of the following genes. Not all any random gene mutation may lead to the oncogenesis. In particular, these group 4 type of genes mutation will lead to the formation of the tumor mass, neoplasia. The first is proto-oncogenes. Proto-oncogenes are genes of the normal cell and control cell proliferation. The second group is tumor suppressor genes, or we call anti-oncogenes. They are the normal cell genes that inhibit, normally in healthy organisms, they inhibit cell proliferation. The third type is the genes of that regulate apoptosis, genes of apoptosis, and at last the genes of the DNA repair system genes. Now you see here the list of proto-oncogenes. The mutation of the proto-oncogene, the mutated proto-oncogene called oncogene. You see here the list of them, the sum of them. Normally, the regulation of cell cycle is due to expression of the proto-oncogenes. Upon mutation of these genes, or a result of the abnormal expression, these cells acquire the ability to uncontrolled continuous division, and they turn into the tumor cells. Proto-oncogenes being dominant, they are dominant genes and encode the proteins that provide proliferation and differentiation of cells. You see here the proto-oncogenes ERB1, ERB2, their mutation linked to the lung cancer, breast cancer, ovarian cancer, and KRAS, NRAS, for example, the cancer of the kidney. You see here the c-MYC proto-oncogene, which is linked with the Burkitt lymphoma, and the big amount of proto-oncogenes are known, and all they are dominant genes. Proto-oncogenes are involved in the synthesis of number of substances, growth factor, transcription factor, their receptors, cytoplasmatic protein kinases, and participation in all the substances, they are participate in the cell cycle. These substances play a role of the reception in the mitogenic signals, factors that cause cell division, and transmission of these signals from the surface of the cell to the nucleus, and the expression of the certain groups of genes. Factors that stimulate mitotic the activity include growth factor of nerves, growth factor of the fibroblast, epidermal growth factor, platelet growth, the growth factor, and others, and some hormones, for example, insulin, estrogen, growth hormone, some cytokines, interleukins, interferons, and even some mediators, the acetylcholine, glycine, for example, the norepinephrine, adhesive proteins, integrins, catecholamines, selectins, macromolecules located in the intercellular spaces, or fibronectin, for example, laminin. All these factors encoded by proto-oncogenes, and they take role in the cell circle, in the proliferation of the cells. The next genes which take the mutation of which take role in the formation of the neoplasia, in the pathogenic mechanisms of the neoplasia, are anti-oncogenes or tumor suppressor genes. You see here the list of the anti-oncogenes, for example, E-cadherin, the NF1, NF2, or APC, this retinoblastoma gene, P53, all they are the anti-oncogene tumor suppressor genes. The mutation of the anti-oncogenes, these genes, result from their inactivation and lead to the unregulated, unlimited cell proliferation. Because in the normal, non-mutated state, they suppress the process of the proliferation. To inactivate the anti-oncogene, a mutation of the both alleles of the gene is necessary, because all these genes that inhibit cell proliferation are the recessive. They are recessive genes. P53 gene is a very important anti-tumor suppressor gene, which take role in the big amount of the tumors, in the mechanisms of the big amount of the tumors. And here in this diagram, this scheme show us how the proliferation we change during if the P53 gene is mutated. As we noted previously, the anti-oncogenes or tumor suppressor genes play an important role in the regulation of the cell cycle. Cell cycle refers to a sequential process occurring between divisions or between last division and the death. In the cell cycle, the anti-oncogenes as P53, the similar gene, retinoblastoma gene, and transforming growth factor beta, they regulate the transition from phase G1 to phase S. They are the phase of the cell cycle. And the other genes, P21, P27, 57, control the transition of the both the cell from the phase G1 to the S and from G2 to the M mitotic phase. Due to activity of these genes, when a cell with damaged DNA reaches the first checkpoint, which is between G1 and S, the first checkpoint, the transition of cell from phase G1 to the S is blocked. This condition creates the conditions for the DNA recovery. If DNA repair does not occur, the P53 gene ensures apoptosis of this cell or its transition into the G0 phase, the resting or quiescent the phase. And almost 70% of all tumors develop due to the mutation of this P53 gene. In this case, the mutated cell doesn't undergo apoptosis, but is continuously included in the cell cycle and acquire immortalization. And immortalization means evasion of apoptosis. The other group of genes that take role in the oncogenesis are genes that regulate apoptosis. Previously in the lecture about the cell injury, enough information was provided on the mechanism of apoptosis. And genes of DNA system, DNA repair system, the main work of this system is to repair a damaged portion of the part of the DNA. Therefore, damage to these genes lead to the fact that mutation in other genes cannot be prevented, as a result of which favorable conditions are created for the development of the tumor disease. Now this slide shows us the very important the points of the neoplasia formation, tumor formation. Here you see the main the etiological factors you see in these columns, and the mechanism, the step by step, the change step by step how the normal cell became transformed into the malignant neoplasia. The first about the etiological factors. You see, as we noted previously, they are environmental exogenous factors and endogenous factors are, for example, inherited mutation of DNA repair system, inherited hereditary the mutation in the genes of the apoptosis. All they take the crucial role in the formation of the neoplasia. Okay, under influence of these factors, the normal cell in the genome of the normal cell DNA damage occur. But the process is reversible here if the patient have the normal DNA repair system. But if the person have the mutated DNA repair system or in the genes of the apoptosis, the repair of the DNA is failure and mutation occur in the genome of somatic cell. And the normal cell transform into the mutated cell. And three, you see here, the main the transformations, main mutations occur in these the genes. The growth-promoting oncogenes, the activation of growth-promoting oncogenes. It means the proto-oncogenes, normal genes which regulate the normal proliferation of the cell, they mutated and became oncogen. These genes always trigger cell to the proliferation, non-stop proliferation occur. The second group is the mutation and inactivation due to mutation, this tumor suppressor genes. We talk about this retinoblastoma gene, P53 and others. And because of inactivation, they can stop the proliferation, division of the cell. And the inherited alteration of the genes of the apoptosis, and apoptosis is impossible. And that's why this clone of the cell, the unlimited proliferation, expansion of this clone of the cell occurs, is called clonal expansion. All these, the step-by-step, this stage, called the stage of the initiation. The normal somatic cell became transformed into the mutated cell. But then the proliferated mass, the proliferated cells, tumor tissue, leave the blood supply, and that's why these cells begin to synthesize their own the oncogen, oncoproteins. And some of these proteins are the factors of the angiogenesis, and they activate the angiogenesis, the main characteristic of the tumor neoplasia. And they escape from immunity. In the first stages, in the previous stages, the immune system active against the tumor cells because they all have the tumor neoplastic the antigens, but because of additional mutations, they possess the ability to escape from the immunity, and the severe angiogenesis occur here. And this stage, all these changes, additional mutations, lead to the tumor progression. And in this stage, the cells, the tumor cells, neoplastic cells, gain the ability of the malignancy, and malignant neoplasia occur, and the main features of the malignancy is invasion and to metastasis. Three main stages of the chemical carcinogenesis. Regardless of specific cause of development of tumor, several stages are distinguished in oncogenesis. The first stage is initiation, the second is promotion and progression. The third is progression of tumor. Initiation, about the first stage. The base of the first stage is the transformation of the cell under the influence of carcinogenic substances, initiators, and transformation of a normal cell into a tumor. Carcinogenic substances are associated with the anti-oncogen, oncosuppressor, or proto-oncogen of the genome of the normal cell. As a result of mutations, the activity of oncosuppressor decreases, the proto-oncogen is converted into an oncogen. There are several mechanisms for the transformation of the proto-oncogenes in the oncogene. Means which mutation, which type of mutation occur in these genes, the proto-oncogene and tumor suppressor genes. It may be insertion. We study all of them when we study the types of mutation. Insertion means inclusion of additional nucleotide to the DNA segment. Then amplification may occur as a type of mutation. Amplification means an increase in amount of same proto-oncogene. Then point mutation sometimes occur, replacement of the nucleotide that makes up the gene with another nucleotide, and translocation of the chromosome. It should be noted that the cell subjected to initiation can take a long time. The transformation of the normal cell into the neoplastic cell, it takes a long time. Sometimes it the years to remain in the state. And the second is promotion, stage of promotion. In this the second stage, the increase proliferates the transformed cell. There must be a stimulative effect. Such stimulators are called promoters. These include, for example, phenol, terpentine, carbolic esters, estrogen, and forbolic esters are considered the strong promoters. Most carcinogens studied can play the role as both initiators and promoters. At this stage, a cell with the altered genotype has a tumor cell phenotype. Thus, oncogenes of transformed cells begins to synthesize proteins. Such proteins called, the oncoproteins. These include growth factors synthesized by tumor cells, receptors for various hormones, growth factors, tyrosine kinase, G protein, and transcription factors, and etc. At third stage of the progression, clinical signs of tumor disease appear in this third stage. At this stage, tumor cell proliferation gets out of the control of the body regulatory mechanisms, and new cell clones are formed that have a combination of various features. Tumor progression is an irreversible process. Tumor cells have a number of features. These, the main important features are the following. The first is self-sufficiency in growth signals, in the growth factors. It linked with the mutation of the proto-oncogenes. Proto-oncogenes mutated into the oncogenes, and oncogenes, the tumor cells which possess oncogenes begin to synthesize proteins which are the growth factor for own proliferation. That's why the non-stop proliferation occur in these cells. The second is loss of the sensitivity to the action of tumor suppressor factors. It linked with the mutation in the tumor suppressor genes. The third is unlimited growth potential. It means non-stop proliferation, division of cells. Again, this linkage is associated with the mutation in proto-oncogene and the mutation in tumor suppressor genes of apoptosis, for example. The third, the next feature is the evading of apoptosis, which linked to the mutation in these genes, and invasion and metastasis. At last, the angiogenesis, the six main features of the tumor cells, and the last two, invasion, metastasis, and angiogenesis, occur, they link it to the additional mutations which occur during the mechanism, during the pathogenesis of the tumor mass. In tumor cells, beside of these six features, in tumor cells, the ability to differentiate is lost. This is manifested in the form of anaplasia. Anaplasia is a loss of the ability of the cell to differentiate, and it obtains the property of the characteristic of embryonic cells. By the loss of the cell differentiation ability, it is meant the loss of the normal structure and functional features of the cell. Atypicalness. Because of the several mutations which happen in the tumoral cells, in the neoplastic cells, they possess the new features, properties. This is called atypicalness. The characteristic feature of a transformed cell is its atypicalness. Atypicalness is a qualitative and quantitative differences between cell and tissue from the original normal and pathological altered cell even and tissue. For example, in hypertrophy, atrophy, dystrophy, metaplasia, changes occur, but the atypicalness of the tumoral cell completely differ from this type of the change. Atypicalness of a tumor cell is manifested in the structure of the cell, its growth, metabolism, functions. For this reason, the several types of the atypicalness are distinguished. Morphological atypicalness, biochemical atypicalness, functional, immunological atypicalness, and atypicalness of growth are of great importance. Now about morphological atypicalness. Two types of the morphological atypicalness are known: cellular and tissue. The morphological atypicalness observed at the level of organoids, cellular and tissue level, let's say. In this case, during the cellular atypicalness, polymorphic cells are formed. The nucleus and cytoplasm are not divided at the same time, and a hyperchromic nucleus is formed. A number of the chromosomes change, and the nucleus and nucleolus become large. Multinucleated cells form, and the relative volume of the cytoplasm decrease. The number of ribosomes increase. The shape and size of mitochondria change. The activity of cytochrome oxidase in the mitochondria decrease. In tumor cells, the membrane surface is relatively larger, and intercellular connections are weak. And in tissue atypicalness, we observe the atypical structure change in the tumor engrossing tissue. And it should be noted that the tissue atypicalness refer to benign tumors, but in malignant tumors we observed both of them, cellular and tissue atypicalness together. This slide shows us the steps of the neoplasia and their relation with the mutations which occur in the tumor cells. You see here in early stage of neoplasia, and due to initial mutations, the tumoral tissue is monoclonal. But due to additional mutations, this monoclonal tissue became the ability of the heterogeneity, and they possess the ability of invasion, metastatic ability, and others. And it should be noted that if the tumor develops as a result of transformation of one cell, then it became monoclonal. It goes through the monoclonal pathway of the development. But if the tumor develops from the several mutated cells, a polyclonal pathway of development occurs. In monoclonal tumor, a transformed cell creates similar clones with the same gene and phenotype. Tumor tissues that go through the polyclonal pathway of development consist of cells with different genotypes and phenotypes. A tumor node formed from one transformed cell consists of the heterogeneous cell clones, because additional mutations at the stage of tumor progression, you see here the last stage of the tumor formation, lead to the formation of new features of tumor cells. Therefore, despite the fact that tumor has a monoclonal origin, it consists of heterogeneous cells. The other type of the atypicalness observed in the transformed cells, in the tumor cells, is atypicalness of growth. The growth atypicalness is characterized by an abnormality in the division of tumor cells, impairing their differentiation, invasive growth, metastasis, and recurrence. An abnormality in the division of the tumor cell leads to the disappearance of the Hayflick limit. What does it mean, Hayflick limit? Each cell is characterized by a certain maximum number of divisions, which is genetically programmed and it is unchanged. This is called Hayflick limit. In tumor cells, this limit is lost and the cell acquires the potential for unlimited division. Normally, when replacing epithelial cells with the new ones, the number of proliferating cells doesn't exceed 5%. And in tumor cells, this indicator can be more than 40–60%. And disturbance in differentiation is manifested by complete or partial cessation of tumor cell maturation. The reason for this is inactivation of genes that provide normal cell differentiation, which occurs as a result of additional mutations during carcinogenesis. Unlimited cell division of tumor tissue is provided by activation of the telomerase, the enzyme of telomerase. So, in middle-aged people, telomerase enzyme activity is high in constantly proliferating cells. In other somatic cells, the activity of this enzyme telomerase is sharply reduced or doesn't exist. As a result, in dividing the somatic cells, as the number of the cell divisions increases and length of telomerase on one or several chromosomes gradually shortens, cell division stops and it ages. But in tumor cells, telomerase activity is very high, which ensures telomere replication, and as a result, these cells acquire the ability to limitless division. Invasion, the main feature of the malignant tumors, and invasive growth is the penetration of tumor cells into the surrounding intercellular space. This process is accompanied by tissue destruction. The invasion of tumor cell into the extracellular matrix consists of the four stages. The first stage is separation of tumor cells from each other. Then the next is degradation, splitting of the extracellular matrix. Then the third stage is connection of tumor cells with degraded components of extracellular matrix, and tumor cell migration of the tumor cell to the other spaces. And at the first stage of invasion, tumor cells are separated from each other. Cadherin E, the protein which provides intercellular adhesion, is known to be a transmembrane protein. The cadherin molecules of the neighboring cells are connected to each other with the participation of the calcium ions, and the cadherin sites facing the cytoplasm through beta-catenin proteins create a bond with the cytoskeletal elements. The combination of cadherins with the catenin ensures the transmission of the anti-proliferative signals towards the nucleus. As a result, mitosis doesn't occur. This is called the contact inhibition. When mutated genes encoding beta-catenin and cadherin E proteins, this process stops and cell proliferation accelerates. At the same time, intercellular communications is disturbed, and the tumor cell is separated from the primary location. In the second stage of invasion, local degradation of the basement membrane and interstitial connective tissue occur. For this, by isolating proteolytic enzymes by tumor cell that are the collagenase, elastase, catepsin, plasmin, and other, by activating them, the basement membrane and interstitial connective tissue are degraded. In this case, conditions arise for the migration of the tumor cell into the healthy tissue. In the third stage of the invasion, tumor cells combine with laminin or fibronectin, which are components of the degraded extracellular matrix. This is due to the fact that there are laminin and fibronectin receptors on the entire surface of tumor cells. Normally, such receptors are located only on the basal surface of the cells. In neoplasia, degraded extracellular matrix creates the condition for invasion and metastasis. Thus, during the splitting of extracellular matrix, the receptors of the laminin and fibronectin located on the surface of the tumor cells ensure their migration to these zones, to other zones. And at the final stage invasion, tumor cells under the influence of the autocrine factors themselves synthesize enzymes, making immobilized movements and migrate to the adjacent intercellular space. In addition, stromal cells active on the cell motility can secrete paracrine substances. The ability of invasion of the malignant tumors form the favorable condition for metastasis. Malignant tumor cells separating from the place of formation of tumor tissue are able to penetrate into their tissue, into other tissue and organs, and form here the tumor nodes with the same structure. This process is called metastasis, and tumors formed in this way are called metastatic tumors. The following pathway for tumor cell metastasis are distinguished. The tumor may metastase by the lymphatic way, hematogenous way, and contact way. Lymphatic pathway, tumor cells, and the most common for carcinomas. They getting into the lymphatic vessels give metastasis to regional and distant lymph nodes. The next is, you see here, the hematogenous pathway, tumor cells, is most common for the sarcomas, spread by getting into the bloodstream. And contact or implantation pathway is a penetration of tumor cells into the nearby organ and tissue. For example, metastasis of the stomach cancer into the mesentery, lung cancer into the pleura. Sometimes the tumor cell metastasis in several ways, and the process of the metastasis consists of three main stages: intravasation, dissemination, and extravasation. The penetration of tumor cells through the vascular wall into the vascular bed separated from the resulting tissue is called intravasation. The tumor cell enters the blood and lymph circulation system. Tumor cells circulate in the blood and lymphatic channels in the form of emboli, and they are implanted in the endothelial layer of the vascular wall. Then the tumor cell goes beyond the vascular wall with the participation of the tumor proteases. And this process is called extravasation and ends with the formation of the secondary tumor node. It should be noted that, depending on the activity of the anti-tumor defense mechanisms and the characteristics of the tumor cells heterogeneity, the development of each of these stages can be prevented. After extravasation, one part of these cells, tumor cells, included in the cell circle, forms a new tumor node. The other part of these cells is destroyed by natural killer cells, macrophages, and the remaining cells remain in the resting phase of the cell circle, G0 the stage. The cell that is able to remain in the resting phase for a long time is called latent tumor cell. The transition of the latent tumor cell from the G0 to the G1 depends on the various factors, hormonal imbalance, weakening of anti-tumor immunity, and etc. In general, a small fraction of the tumor cells, 0.01% from metastatic clones, secondary tumor node, and metastases are organotropic. For example, lung cancer metastasized to bone, the liver, brain, stomach cancer to ovaries, the breast cancer to bone, lungs, and liver. Organotropism depends on the direction of the blood flow and lymph flow of the organ in which the primary tumor is located, and on the presence of the ligands on the endothelial vessels and target organs corresponding to the receptors on the surface of the tumor cells. For the development and metastasis of tumor, vascularization of the tumor tissue, angiogenesis is important. In tumor tissue, angiogenesis is observed in both primary and metastatic tumors. Tumor cells synthesize factors that stimulate angiogenesis. Angiogenesis factors are the vascular endothelial growth factor, platelet-deriving growth factor, fibroblast growth factor, and others. All they stimulate vascularization and give tumor development of the malignancy. The main factors that triggers the release of the angiogen is hypoxia. And now, in brief, about biochemical atypicalness. Biochemical atypicalness in the tumor cell is manifested in all types of metabolism. The atypicalness of the protein metabolism is manifested by increase in the involvement of amino acid in protein synthesis and increase the synthesis of the oncoproteins. That's why we say tumor cell is a trap for nitrogen containing compounds. The atypicalness of the carbohydrate metabolism is characterized by an increase in the penetration and utilization of glucose in the tumor cells. That's why we say the tumor cell is a trap for the carbohydrates. And it's known that increased anabolic and anaerobic glycolysis is compensatory reaction that occur in all typical pathological processes where ATP deficiency occur. In such cases, the penetration of oxygen into the cell increases the activity of tissue respiration. This is called positive Pasteur effect. In tumor process, anaerobic glycolysis is also intensified. However, the penetration of the oxygen into the tumor cell doesn't increase the activity of this tissue respiration, and the process of the anaerobic glycolysis doesn't weaken. This is called negative Pasteur effect or Warburg effect. This is caused in the tumor because in the tumor cell the activity of glycolytic enzymes, for example, phosphoglycerate kinase, dehydrogenase, and others increases, and the activity of the tissue respiration enzymes, for example, the cytochrome oxidase, catalase, reduced. And imbalance between glycolysis and tissue respiration leads to the decreasing of pH. And it was found that the tumor cells, in comparison with the normal cell, consumes less oxygen, and that's why tumor cells are more resistant for hypoxia. And activation of the glycolysis leads to the decrease in blood glucose due to the occurrence of the hypoglycemia in the body. The synthesis of the glucagon, adrenaline, glucocorticoids increases compensatory. Gluconeogenesis increases. And these hormones increase the breakdown of proteins and fats. As a result, tumor intoxication of the organism, the neoplastic intoxication of organism and cachexia during tumor occur. In atypicalness of the metabolism, lipid metabolism is characterized by an increase in the utilization of the high-density fatty acids and cholesterol. That's why we say tumor cell is a trap for lipids, and an increase in the synthesis of lipids that make up in the cellular structure. Due to the intensive absorption of the fatty acids, lipoproteins, and cholesterol from the blood by tumor cells, the occurrence of the atherosclerotic change in the vessels of cancer patients is relatively low. Functional atypicalness of tumor tissue is characterized by decreased hyperfunction in the function of the blast transformed cells, or its qualitative change, dysfunction, and sometimes is increased the hyperfunction. For example, in hemoblastosis, leukocytes cannot perform phagocytosis. In liver carcinoma, hepatocytes lose ability to synthesize albumin. And in pheochromocytoma, insulinoma, the synthesis of the corresponding hormones, catecholamines and insulin by tumor cell increases. And in other cases, tumor cell is capable of the synthesizing proteins, hormones that are not related to the tissue from which it developed. For example, in small cell lung cancer, transformed epithelial cells of the bronchi synthesis glucocorticoids. This leads to the development and the ectopic form of the Cushing syndrome. Tumor cells in liver intensively synthesize embryonic alpha-fetoprotein. During myeloma, the tumor cells secrete synthesize the Benz-Jones proteins. And the detection of these substances, such proteins in blood plasma, they are tumor markers, is a great of the importance in the diagnosis of tumor diseases. Immunological atypicalness of the tumor tissue is a change in the antigenic properties of the tumor cells. And tumor antigens recognized by the organism T lymphocytes are. The several types of these antigens are known. Antigens formed due to mutation of oncogenes and tumor suppressor genes. It's the first type of the oncogenes and antigens. And the second is antigens formed due to the mutation of the other genes under the influence of various carcinogenic factors. The third is proteins formed due to the overexpression of normal cell genes or synthesis of the proteins characteristic for some cells in the other cells. This is called heteroantigens. And at last, the antigens caused by viral the oncogenesis, in virus oncogenesis. All these antigens are recognized by T lymphocytes. And however, there are antigens that are not recognized by immune system during some the tumor processes. These include oncofetal antigens, altered glycoproteins, and glycolipids on the cell surface, specific differentiated cell type antigens. The oncofetal or embryonic antigen synthesized only in the embryonic period, normally only in the embryonic period. In adulthood, the activation of genes encoding these antigens leads to the fact that their synthesis again increases. Detection of the antibodies synthesized against them in the blood plasma is considered a cancer marker and confirms the existence of the oncofetal antigens. And on the surface of tumor cells, qualitative and quantitative change in glycoproteins, blood group antigens, mucins, for example, can be detected. And they play a role of the tumor markers on the diagnosis of tumor diseases. Sometimes tumor cells begin to express on their surface molecules inherent in the cell from which they originate. They are called antigens of the specific differentiation. These antigens play an important role in identifying the original tissue of tumor development and in conducting immunotherapy. And due to the fact that antigens of specific differentiation are normal antigens of the body, they don't cause an immune response. The influence of carcinogenic factor on the body, activation of the oncogenes, and transformation of normal cell into the tumor cell doesn't always lead to the formation of the tumor tissue, tumor mass. In the formation of the tumor, the weakening of the antiblastomic resistance of the body plays an important role. Anti-cancer or antiblastomic resistance of the body includes the anti-cancerogenic mechanisms, anti-mutation mechanisms, and anti-cellular mechanisms. The first is the anti-cancerogenic mechanisms. The basis of the anti-cancerogenic mechanisms are inactivation and breakdown of cancerogens in the body fluids and cell as a result of oxidation, demetallization, and others. It's a metabolism, breakdown of these, for example, chemical cancerogens in the body. The second is blockage of the penetration of the cancerogens into the cell or cell nucleus, their inactivation and elimination from the body. Then inactivation and cleavage, breakdown of cancerogens as a result of their phagocytosis. And the elimination from the body the certain carcinogens with the properties of haptens, which undergo destruction with the participation of the antibody and T lymphocytes. The second system mechanism is anti-mutation mechanism. Anti-mutation mechanisms are aimed at preventing the transformation of the normal cell into the tumor cell. The anti-mutation mechanism is carried out due to the activation of cancer suppressors, mainly by P53 anti-oncogene, tumor suppressor gene, and activation of the DNA repair system. And it was the third mechanism is the anticellular mechanism. The significance of this mechanism is to identify and destroy genotypically and phenotypically foreign cells in order to maintain the constancy of the normal cellular composition. There are non-specific and specific mechanisms of the anticellular system that has an anti-tumor effect. Non-specific anticellular mechanisms are carried out by macrophages, natural killer cells. Like other genetically foreign substances for the body, tumor cells undergo macrophage phagocytosis. And natural killer cells destroy tumor cells that have lost MHC1 molecules and a result of the mutation in them. Specific anticellular mechanisms are realized with the participation of the cellular and humoral immunity. In cellular immune response, cytotoxic T lymphocytes stimulated by tumor antigens either by directly connecting to tumor cells or by secreting various cytotoxic substances and destroy tumor cells. In humoral immune response, from plasma cells, specific immunoglobulins are synthesized. And it last about the diagnosis and the general principles for the treatment of neoplasia. The early diagnosis of tumors is based on the modern advances in the molecular biology and genetic engineering. From this point of view, determination of the tumor markers is of great importance. The clinical assessment of malignant tumors depends on their size, involvement in the process, the regional lymph nodes, and distant metastasis. And for this, the criteria of TNM system are used. T tumor, N means lymph node, and M the metastasis. T indicates the size of tumor, and the regional lymph nodes involved in the process, the Z number, and the M indicates the presence of the metastasis. One of the criteria to verify the degree of the histological and biological malignancy of the tumor is proliferation index, PI index. And the marker for determining the PI is expression of the Ki67. Ki67 is a nuclear antigen, and which is an indicator of the cell being in the stage of division, proliferation stage. PI shows a ratio of the cells in the division stage to all the other and allows the isolate tumor cells that are in the active phase of the cell circle throughout its duration. G1, the S, G2, M phases of the cell circle. And Ky67 is absent only in the G0 the period of the cell circle. And knowing the index level, you can make the survival prognosis and choose the optimal treatment tactic. If the index level is high, that is, there are a lot of the proliferating cells, then such cancer is well served by chemotherapy. This is due to the fact that chemotherapy drugs kill only those cells are in the stage of the proliferation. The classic, the triad, for the treatment of the cancer patient is the surgical treatment, the removing of the tumor mass, then chemotherapy and radiotherapy. And also immunotherapy treatment with the monoclonal antibodies is used. And thanks for attention.